Good day, friends, and a warm welcome to this edition of KK Med Talks. And today we'll be having another episode of the Vitamin D Talk Show. Now, vitamin D is something that is important. We all know that. But we'll talk today about maternal health. And allow me to introduce our guest, someone who is very well known across the country for his skills in both science as well as in speaking. So, warm welcome, Dr. Rohan Palshetkar. Dr. Rohan is chairperson of the Foxy Young Talent Promotion. I wonder if all of you will put in a word for me. Maybe he'll help promote me as well. He is also professor at the D.Y. Patil School of Medicine, and he works non-stop, actually unceasingly, with not only the Maharashtra OB-GYN Society and the Mumbai OB-GYN Society, but with our national societies to spread the message of safe motherhood, to spread the message of good health. Warm welcome, Dr. Rohan.
Thank you so much, sir. It's really a pleasure being here as well. Thank you for having me on your talk show.
Thanks a lot. So, Dr. Rohan, I was wondering about that first part, young talent promotion.
Yeah.
Will it be a lucky day for me today?
Sir, I think there's no one younger than you. I think age is all just in the mind. It's all about how you perceive life. And I think, sir, for you, I think you're younger at heart than anybody else I know. So honestly, sir, more than happy to have you at any point of time in our committee and giving your education to all our patients and doctors as well.
So that makes my day, and it makes the day of everyone else who is watching KK Med Talks and the Vitamin D show today. Thanks a lot, Dr. Rohan.
Yes.
Dr. Rohan, this vitamin D, it's a very tiny molecule. It's a fat soluble vitamin. People debate about whether it's a vitamin or a hormone. We
Yes.
call it a hormone because of the biochemistry, because of the physiology. And lots of people logged in, including Dr. Noor Aga Danish, who is listening all the way from Kabul, Afghanistan. So
Oh,
he
wow.
sends a salam to you.
Oh, thank you so much. So happy to see we have an international audience who's coming to learn about vitamin D and maternal health as well.
Yeah. Now, it's said that women hold up half the sky. And actually, if at all there was an error in that, I'm sure both of us would admit that women hold up more than half the sky because
Definitely.
they perform more than their fair share of duties, their responsibilities. Let's talk about vitamin D and maternal health, and maybe let's begin with preconception. So, Dr. Rohan, how frequently do you see subfertility? And can you please teach us what are the subtle differences between infertility, being barren, subfertility? What's the right word to use? How do we communicate with our patients when they come to us?
Absolutely, sir. Firstly, I want to say that I'm so happy that you've taken up a topic like vitamin D. I think it's something that is so underplayed because we're like, oh, vitamin D deficiency, nothing really happens, and we're not really concerned about it. And it's one thing which needs to be given importance to. And the best part is the treatment is so simple for it that we still underplay it. In fact, I'm sure, sir, you'll also agree as doctors, if you look at a hospital, 99% of the medical staff as well as the doctors are always vitamin D deficient. And we
That's
also don't pay attention to it unless then when we start feeling our joint pains, our bones are aching, and that's when we wake up and realize we need to treat it. But sir, now coming back to your question about infertility, when we look at infertility, we, as per the WHO definition, it's always said that infertility is a couple who's been trying for at least 1 year without contraception. So we always say that you should give at least a 1 year period of continuously of unprotected intercourse, and only if you don't conceive with that, that's the only point it should be termed as infertility. Now, this is very confused with being barren or sterile. Now, when you talk about being barren or sterile, I think those terms should be completely eradicated from our dictionary at this point. Considering that we have technologies where almost everyone can be given an opportunity to achieve parenthood, I think these terms need to be taken out of play completely. Well, subfertility is a different issue. Subfertility is when you don't have optimum parameters, or rather one partner could be fertile while the other partner could have subfertility. In terms of, if you look at men, the sperm is the whole and soul when we look at fertility wise. So if you're looking at the count, you're looking at the motility, and you're looking at the morphology, These are three parameters generally what we look at when we look at fertility for a man. However, if any of these parameters are on the lower side, it doesn't mean that they're infertile. It could mean that they're subfertile. The only time I would say they would be infertile if the count was zero. But that also doesn't mean that they're barren or sterile. We've got techniques to even achieve getting sperms from the testes itself and allow them to achieve fertility. So honestly, if you've noticed, at no point have I been using the term infertility. We always say that there are fertility issues. No person can we term, at least in our approach towards our patients. I think we should eliminate the terms like sterile, barren, and infertile. We should always approach it towards a positive because it also plays a major socio-psychological impact on our patients as well.
Hmm. That's very true. The way you speak with your patients, and every word, every phrase has a weight, and patients
Yes.
remember that. People remember that. A warm welcome to Anamika Anuji, who has joined the conversation. And what she suggests is that when you are counseling let's say, a young girl or a young woman, uh, you might say that yes, maybe I do not know, and this is speaking to all general practitioners, all people in the public. I do not know how to help you, but I'm sure there are people who can help you because ART, assisted reproductive technology, has made so many strides. Certainly, there is a treatment for you. We just need to get you to the right doctor, the right specialist.
Absolutely, sir. And I think it's important that the referral happens early and well in time so that it doesn't get more difficult for the couple to conceive at that point. Honestly, sir, when we began with IVF back in 1978, when the first IVF baby was born, our success rates were only 5 to 8%. Now, if you go to look at it, they're almost close to 40 to 50%. So you can see the amount of strides in the technology, in the techniques that have changed it to a point where even using artificial intelligence at our lab right now to actually help people decide whether which embryo to choose, which eggs have the most potential to become a blastocyst. So all these technologies just change the entire forum in order to approach towards the fertility, in fact.
Right. So, Dr. Rohan, in all these patients who are coming to us in preconception, some of them may be fully fertile, but they are still in the preconception phase. Some
Yes.
may be subfertile and different degrees of maybe male plus minus female factor. Uh, when we speak from a general medicine perspective, we say that before going for pharmacological optimization, before trying to optimize the drug therapy, you have to ensure lifestyle and nutritional optimization. So yeah, if the framework is not strong, if the foundation is not strong, you can't build a good building on that. So
True.
is this true for the preconception phase? How important is nutritional optimization for a couple, that is both the man and the woman, both of them who are planning pregnancy?
So let me talk about it from a fertility point of view. Like I
Yes.
do get couples who have not had a baby for plenty of years, and I also get couples who've been married for just 2 months and have come saying that okay, we are planning to start conceiving. Can you advise us on how to go about it? Whenever I look at this, I generally spend about 20 to 30 minutes with them understanding what their lifestyle is. Because some people, they may look healthy, but their nutrition, their lifestyle is very erratic. You have people working from different forays. You have them working 15 hours, 16 hours a day, sleeping 3, 4 hours a day. They're eating breakfast at 1 in the afternoon, lunch at 5 in the evening, and dinner at 1 a.m. or 2 a.m. So in that situation, we always consider that lifestyle modification is highly important. Look, sleep is equally important as along with your nutrition. Then also, if you look at today's day, smoking, drinking has become very common. Even the use of recreational drugs has become something that I've been coming across my practice. So these are things where we tell them that look, if you're being serious about getting pregnant, we need to ensure that your lifestyle, your nutrition are always going to be on point. See, even for these, we always do, whenever I'm testing a patient, vitamin B12 and vitamin D3 are a major part of my testing because these need to be brought into normalcy before they going on, before we go ahead for fertility. Vitamin D3 and B12 are surprisingly deficient in a lot of the Indian population, at least what I've been seeing in my practice. And that's something that needs to be targeted at an early point rather than starting it after they're pregnant or while they're going through their treatment process.
That's very true, and we see the same type of patients in our practice, whether it is general medicine or endocrinology or obstetrics. So,
Yeah.
vitamin D deficiency, B12, these are very common. And if you don't optimize the vitamins, the micronutrition, somewhere along the way you will get stuck. So, sir, in and like you said, it's better to optimize before pregnancy starts. So now let's compare the preconception phase with the first trimester. What kind of vitamin D doses do you use in the pre-trimester, in the preconception phase?
So in preconception, whenever I see a vitamin D deficient patient, I always believe that I prefer the weekly doses because I feel that the compliance sort of gets better. So a tablet once a week of 60,000 international units, I give it for about 8 to 12 weeks, and then I give a monthly dose to them for maintenance, because that's what I've seen is compliance is good. They put an alarm, weekly alarm, which is probably on a Saturday or a Sunday, because that makes it a lot easier for them also to handle it. Because if you're looking at a working couple, we're looking at a couple which is probably waking up at 6 a.m, making sure that they're getting their breakfast, lunch ready, rushing to work, getting ready in the morning. Someone needs a cup of coffee, someone needs a cup of tea, without which they don't function well. So in that, they forget to take this one capsule on that day. On a Sunday, I'm sure Dr. Karla, you'll also agree, we also as doctors do get that little bit of extra 15 minutes to just rest and relax. At that point, when your alarm rings, okay, you know that your vitamin D3 time has come. See, because I say Sunday because I take my vitamin D3 on Sundays. It's fixed. I'm right now on my maintenance dose, so I take it on the first Sunday of every month. It's put in my calendar, the alarm rings, and I'm taking it every first Sunday of every month. It just gets easier for me. And I believe that we should practice what we preach. And this is exactly what I tell my patients, that look, vitamin D3, yes, you're not having any symptoms right now. You're feeling fit, you're feeling fine. You don't want things to get delayed. It's like, I'm sure we've seen with diabetes and hypertension. Initially, the symptoms are just high sugars and the blood pressure is high. We don't want the end organ damage to occur. So same thing with vitamin D3. There's no proven thing that is going to cause damage in the long run. But at the same time, why wait for anything to go wrong? Like, why wait for the joint aches? Why wait for the bone pains? Why wait for the fertility to have issues? Better to treat them early, better to treat them well and manage that. When I come to the first trimester also, I believe that you can still give vitamin D3 once a week, because I prefer not to give the daily dose, because look, there is nausea and vomiting of the first trimester, which we have to take into account. The women don't feel like eating in the first 3 months. I prefer that you take your once a week, where you're literally forcing yourself to have it. Even in the first trimester, the appetite is suppressed, so a once a week dose doesn't affect them as much. And they are taking their folic acid, they're taking their antiemetics as well, so they're taking their ondansetrons, their dicyclomines, etc. So these all things also affect their day-to-day medication taking. So I think the once a week dose does wonders. It works much better in terms of compliance, and I think the patients prefer it as well.
That's true, and I would agree with you regarding the tea and coffee. I also need my daily fix. So, what's your preferred beverage, Rohan? Is it tea or is it coffee?
So it actually depends on the morning. I actually have a iced black coffee early in the morning. So if I remember to put it for brewing the previous night, it's coffee in the morning. Otherwise, it'll be a hot cup of tea.
Tea. Okay, that's a nice way of taking things. In Haryana, our preferred beverage is milk, and the average intake is about 1 liter a day. So
Oh wow.
we need that for survival. And a warm good evening to Dr. Shashi Khare and Dr. Bimla Kapoor, madam, also who've logged in. So you were speaking about weekly, and I recently learned this new English word, which is circa septan. CIRCA. Circa means roughly, around, and septan, SEPTAN, that means 7 days. So a circa septan dose of vitamin D is what Dr. Rohan recommends, and what I would also agree with, what I think the vast majority of doctors in the world would agree with.
Yes,
A circa
absolutely.
septan
So
dose.
thank you for enlightening me about this new terminology as well. It's something that I'm also coming across for the first time. So thank you so much for that.
And we have a quiz for everyone who is logged in. We'll request Faraz from backstage to put this in the comments. Two more words: Circa Tidal, Tidal, and Circa Lunar from the moon, Lunar. Circa Lunar. What do these mean? So that's our quiz question for today. We'll just have it in the comments shortly for everyone to read and
Absolutely.
see. Okay, so in the preconception phase, we can give once weekly vitamin D. Now, somebody comes to me and says, Doug Sahab, you've told me not to take any medicines without asking you because
Yeah.
we don't want even the slightest risk of teratogenesis. Uh,
Absolutely.
and yeah, that would be true for things like antibiotics, anti-epileptics, things like that. But is
Yes.
vitamin D safe? I am on vitamin D once weekly. Supposing I conceive, I miss my periods today, urine
I
pregnancy test comes positive. Is that cause for celebration or is it cause for fear, for concern? Because I am on vitamin D once a week.
I think it's a cause for celebration. I don't think you really need to worry about it. Vitamin D is generally a very safe drug. It's not something that I'm majorly concerned about. In fact, if you're taking it, you can continue it. But if you choose to stop it, I always give the option to the patients. I'm like, I would like to minimize your medications in the first 3 months to just folic acid and something to control your nausea, vomiting, and pregnancy. So if they stop it for those 3 months where they are being overtly cautious that I don't want to take vitamin D3, at that point I tell them, fine, stop it. But the minute they finish their first trimester, I immediately begin them on once a week. Again, I actually check the vitamin D3 levels then to see whether they've been able to maintain it. Are they sufficient, deficient, or are they insufficient? So if they're insufficient, I give them weekly for 1 month and then get onto a maintenance dose of once a month. If they are deficient, then I just tell them to take it for 8 weeks and then go on to the maintenance dose of once a month. And if they are if they are sufficient, I tell them just maintain the maintenance dose of once a month so that they are not too stressed about it. And at no point do I want deficiency, because we have to understand the baby can't produce its own vitamin D. The mother's vitamin D levels are only the ones which are going to pass on to the fetus. So if the mother is sufficient, she's going to give good amounts to the baby. So that's the only way is the baby going to be able to maintain the vitamin D levels. See, we always say, Dr. Karla, I'm sure that this thing which we talk about, that if you are vitamin D deficient, go out in the sun and roam about. What people don't understand is we have a lot of melatonin in our skin, so absorption is reduced. Number two, we are clothed from head to toe. We all, as doctors, we have our shirts, we have our pants, we have our lab coats, so we're only exposing maybe less than 5% of our body to the sun. That's not enough for absorption.
Mm.
In addition to that, we're sitting in our cars, we try to avoid the sun, we're in the shade and we believe, we're out in the sun. We'll go in the sun, sit under a tree. That's not exposure to sunlight. So in those situations, we have to understand that how much ever we may try to go out in the sun. I always used to believe, I used to play a lot of football and basketball back in my younger days. I still try and go once a week right now. But going out in the sun, I'm covered I put sunscreen on my skin, hand, feet. Where is the absorption going to happen? We're all reflecting all the UV rays. So there's no chance that we're going to actually get natural absorption to produce vitamin D3. So I think supplementation, irrespective of how much ever you're exposed to the sun, I think is still required, whether you're pregnant or not pregnant.
So thanks, Dr. Rohan. The messages we get are number one, in pregnancy, the management will be the same as it is in non-pregnancy. So the same way that you would treat a non-gravid adult, you will treat a pregnant woman in second and third trimester in the same manner. And do not
Yes.
hesitate in giving weekly doses. The bioavailability is good.
Yes.
Second message we get is that because of our lifestyle, we are actually blessed with the sun. But unfortunately, we are a very heliophobic kind of a country. We are phobic of the sun. And apart from the sunscreens and the cosmetics that you spoke about, which is a modern invention, we've also added air pollution to the list of things which reflect the
Absolutely, sir.
UV rays away from us. So when you have an
Absolutely.
AQI of 447, which is what Delhi has now, even Kanal, where I live, which we feel is a very pleasant and non-polluted kind of a place, our
Yes.
AQI is also hovering around 250.
Yeah.
So
So that does affect the absorption.
yeah, The air pollution, the fog, the smog, it prevents the UV rays from reaching your skin. Whatever reaches, the sunscreens, the cosmetics, and the clothes that we wear, and then they play havoc.
Absolutely. Apologies. I absolutely agree with you on that, sir, because I think air quality is something that we really don't take into account. Like, even when I was telling you about the exposure to sunlight, at no point did it strike me that, yes, our air quality in India is highly affected, and that also affects the absorption rates as well. And that's something that we need to, like, in Bombay the other day, the air quality actually dropped down to 110. Like, it was a good AQI, and we were very happy about it. But at the same time, when you're talking about Delhi, and we are a very diverse country, we've got the north, the south, the east, the west, the central zone, where the AQI varies quite a bit. And that's something that we need to take into account as well when it comes to the absorption of vitamin D3.
So, coming back to these ladies in second and third trimester, uh, supposing vitamin D goes low, what happens to the fetus?
So, as I said, sir, when the baby, when we have vitamin D3 is low, there have been research papers which have talked about when vitamin D3 is low, there's a risk of developing blood pressure in pregnancy. There's also a risk of preterm labor in pregnancy as well. So these are a couple of things which are there, and something which is very as simple as having a weekly dose can ensure that this doesn't happen. Why not? See, I'm not saying that vitamin D3 is the whole and sole reason why this happens, but it seems to, the research says that it seems to be one of the contributive factors. And as an IVF specialist, I deal with majority of the patients above the age of 35. They are already at a high risk of developing hypertension as well as preterm labor, because again, yes, I deal with multiple gestation, that's twins. I do deal with that a lot. I want to make sure that I'm covering all the factors that can prevent the patient from either developing blood pressure or having a preterm labor. And if I know that vitamin D3 has been suggested as a factor to possibly cause these problems, I would like to make sure that I'm at least covering that part of it. See, we also add calcium, we add our aspirin, we add progesterone and all these other factors as well. But why neglect vitamin D3 when we know that it's something that's easiest to treat? See, with calcium, with aspirin and all, these all have their own side effects as well. Vitamin D3, when we know which all the research papers, in fact, we've worked with the Endocrinology Society of India, Foxy has worked with them and come up with guidelines also for vitamin D3. In fact, Foxy also recommends that either you give 60,000 or 2,000. I personally believe that the 60,000 units is much better because compliance is best. It's suggested that if we can give that, we can prevent these problems from happening. Look, I think it's been said since I don't even know how many years. I think I would say 1,000 years that prevention is better than cure. We've been saying that always, even as kids. Before I even had the reason to be a doctor, I had the urge to be a doctor. We've always said that prevention is better than cure. If we can take preventive precautions with a drug which has minimal side effects, why not use it when we know the actual dosage without having toxicity? Why not use it and make sure that our pregnant mothers stay healthy, stay fit? And with a sufficient dose, we're ensuring the fetus that is born is also born with good levels. We're ensuring that the fetus doesn't isn't born with deficiency. And no, we always want our children to be healthy, to have a better life than us. This starts while they're in the uterus. So if we can ensure that the D3 levels of the fetus are good while the mother is pregnant, why not achieve that, and why not make sure that the mother and the baby are healthy at the time of delivery?
Uh, Point well taken, sir. And we welcome Ali Nazakat Sahab and Rekha Butara Madam to the show. Now, many times patients will ask you, sir, how does vitamin D act? Now, the thing is, vitamin D acts in so many ways that it is difficult to explain within a few minutes in the OPD. But the simplest way would be to speak about the endothelium. So, in our body, there are lots of blood vessels. The entire body is full of blood vessels. The mother needs these blood vessels to transfer her nutrients to the baby, to the fetus, and that is done through an organ known as the placenta. And
Yes.
in in uh, in Hindi, in Marathi, in every Indian word, there is a specific word for placenta, so it is easy to explain in the local language. In that placenta, there are lots and lots of blood vessels. These blood vessels are lined by something known as the endothelium, that is the inner lining of the blood vessel. Now, each and every lady, each and every girl knows what inner lining means is because they know what endometrium means. So they know that that is shed during the periods. So the concept of endothelium is not difficult for any lady to grasp. So what vitamin D does is it stabilizes the endothelium. It prevents endothelial dysfunction. If the endothelium is healthy, that is the inner lining of the blood vessels is healthy, so more blood can reach the fetus. So that is the easiest way of explaining. And Dr. Rohan, could you take on from here and now talk about PIH or maybe gestational diabetes? How are these different from what we see in non-pregnant adults, and how
Yes.
vitamin D can help reduce the risk of PIH and the other more dangerous types of hypertension that occur in pregnancy, which are really
Absolutely,
scary.
sir. I think, sir, you brought up a very good point, and I think you've explained it beautifully. When you're talking about the endothelium, that's the inner lining of the vessels. If the vitamin D3 is acting over there and making sure that enough blood flow is going through, in a deficient state, remember, there is a chance that they may constrict those vessels, and that increases your blood pressure. See, besides vitamin D3, there are a lot of other factors as well which lead to preeclampsia or this gestational hypertension, as we speak about. So this gestational hypertension with the vitamin D3 supplementation is going to be an additional and additive support. We obviously, the minute hypertension is set in, we have to use the antihypertensives. But if they're vitamin D deficient, it's important to apply rather than apply, supplement the vitamin D3, because this is going to give an added benefit and going to support the pregnancy while there is hypertension. Remember one thing, when we're looking at a non-pregnant state of hypertension, we're looking at medications which can easily be managed along with diet and nutrition. However, in pregnancy, I can't expect my patient to be dieting and also be exercising extensively, which can bring down the blood pressure by itself. Yes, we're going to give them a salt restricted diet, a protein rich diet. We're also going to ask them to take leisurely walks, but we can't expect them to go to the gym and do vigorous exercise. So at that point, when we are giving the vitamin D3 along with the antihypertensives, it's going to play a synergistic effect and make a role. Also remember that hypertension in pregnancy that develops after 20 weeks of gestation is considered hypertension in pregnancy. Anything before that is, that means the blood pressure was probably there prior to the pregnancy, and it's not counted as a pregnancy of the it's not counted as the blood pressure of the pregnancy. In diabetes, the other way around is that diabetes which is diagnosed after you get pregnant is considered diabetes of pregnancy. In diabetes of pregnancy, again, when we look at it, most of the patients do regress from this diabetes and blood pressure once the delivery is done. Once the baby is delivered, they do regress, but about 10 to 15% of these patients will continue having these symptoms, and about 50 to 60% are going to develop blood pressure or diabetes later on in their lives, not just during the pregnancy. So at that point after delivery, yes, your lifestyle modification, your diet, your exercise is going to play a major role in ensuring that you delay all these effects from happening. And when we look at diabetes, yes, remember, if you have diabetes in pregnancy, you have a twofold to threefold risk of developing hypertension during pregnancy. So at that point, again, you have to make sure that you are looking after yourself, checking all your blood parameters, your vitamin D3 levels, your calcium levels, all your liver function tests, kidney function tests, and making sure that everything is well within the parameters to ensure that you have a healthy pregnancy and you have a healthy baby that's born at the end of it. Dr. Carla, I think your voice is not coming,
Yeah.
it's muted.
At this point about having a healthy baby, actually, that's the entire aim of maternal health, having a healthy baby and a healthy mother at the end of it all.
Yes.
So, points that we get from Dr. Rohan are, first of all, do remember that diabetes and blood pressure, these are very common in pregnancy now. The modern lifestyle is such that 15 to 20%, maybe more women have these.
Yeah.
And they're a very dangerous duo. Also, remember that the cutoffs for diagnosis that a gynecologist would use are much, much lower than what are used in non pregnant adults. In
Yes.
general, where I would diagnose pre-diabetes in a non-pregnant adult, the obstetrician would diagnose gestational diabetes. And where I would say pre-hypertension, and I might say lifestyle modification, for a pregnant woman, it is hypertension.
Yes.
PIH. And
Yes.
lifestyle modification is good, but you cannot expect someone in second or third trimester to begin intensive exercise if she's never exercised in her life before.
Absolutely. I completely agree with you.
Let's share a few concepts from philosophy, from religion, and then ask Dr. Rohan how vitamin D and maternal health come into the picture.
Yeah.
So, in Indian philosophy, we have this concept of karma. Karma can be past tense, what you did in the past. How did I choose my lifestyle before I began planning pregnancy? That is the past.
Yeah.
What am I doing today? What am I doing during pregnancy for my health and the health of my fetus? And karma
Yes.
also means tomorrow. What health or what results will accrue to me tomorrow? So, this is
Yes.
what karma is. Now, in Buddhism, there is this concept of transfer of merit. I can choose to do good things, get good merit, and I can choose to share that merit with someone else. So, for
Yes.
example, now Dr. Rohan is so kind to me. He's the young guy here, and he said, "Sir, you also look young." So, that is like transfer of merit. Now, in Islam, also, we have the same concept, and it sounds so much more beautiful in Urdu, and it is called Isal e Sawab. Isal e Sawab means you pray, you earn good merit, and you can share it with anybody else who is live or also who is deceased, like someone from the previous generation. Now, if you can go transgenerational backwards in Islam, Isal e Sawab, then the question comes up, why can we not go forwards? So the concept is transgenerational karma. Transgenerational karma tells us that if the woman who is in preconception, or the mother who is pregnant, or the postpartum mother, she follows the right karma, she does the right activities, she can improve the karma of the next generation of the unborn baby. So, Dr. Rohan, in pediatrics, we in endocrinology, we have this A, B, C, D, E because actually beyond that, we are not able to think. We are not like the women health specialists who are doing so much of multitasking. They are like Mother Durga. So, for us, A is for anemia, B is for blood pressure, C is for circumference of the antenatal mother. That means weight gain.
Yeah.
D is for diabetes, uh, and D is for vitamin D as well, and E is for endocrine things like thyroid. So
Yes.
now, yeah, transgenerational karma tells us is that the hemoglobin should be just right. The
Yes.
body mass index should be just right, Goldilocks zone, neither too much nor too little. So
Yes.
similarly for vitamin D. So now, sir, our question is this isale sawab or transfer of merit. How is that linked with vitamin D? Can we confidently tell a lady who has come to us in pregnancy, if you take care, madam, of your hemoglobin and your vitamin D, and of course your sugars and thyroid, then not only will you be healthier, that is your own karma, the fetus will be healthier, but even when the fetus grows up to be an adult, the fetus will be healthier.
Yes, that's actually very true. In fact, let me break each one of these points into separately. If I look at anemia, we always say, and even the World Health Organization (WHO) has set different parameters for different trimesters with the hemoglobin level. We always try to ensure that our mothers have a hemoglobin of above 11 because we want to make sure that the iron stores. See, your hemoglobin may be 11, but if your iron stores are depleted, the baby will be born with proper hemoglobin, but the baby's iron stores itself would be deficient. So at any given point, if you're anemic, you'll be giving enough blood to the baby to make sure that the hemoglobin's normal. But where you need to supplement those iron stores. It's the similar thing with vitamin D3. If you look at vitamin D3, we always look at the vitamin D3 levels. Again, I talked about exposure to sun. How is that baby inside the uterus going to get exposed to the sun? There's no way of that happening. We're not going to put cosmetics on the baby at any point once they're delivered. But even then, in fact, we say exposure to sun prevents neonatal jaundice. So that is one way we actually make sure that the baby's vitamin D levels keep going up and the babies have the advantage of being exposed. But the whole point is, why not make it transgenerational? Keep yourself fit with the vitamin D levels which are normal, allow the baby to be born with the vitamin D levels normal, and allow the baby to maintain normal levels. It's going to help with the growth and overall development of the baby as well. If you look at hypertension and diabetes, Hypertension and diabetes is what we say that if the mother is fit prior, like when you talked about the BMI, sir, when you talked about the BMI prior to the pregnancy, a mother or a woman with a normal BMI in India, we consider 18 to 23, but I would say extend it up to 25. If you look at that BMI, these mothers have a lesser chance of developing hypertension and diabetes. That means lesser chances of complications during the pregnancy. That means lesser chances of the baby having any complications of being low birth weight or very high birth weight or having an early delivery. And so when you look at endocrinology, and please correct me if I'm wrong, I think the thyroid hormone is something that's most important for neurodevelopment of the fetus. So we want to make sure that the TSH levels, the thyroid stimulating hormone levels, are absolutely normal. We want to make sure that you are able to achieve those levels, because then the baby's thyroid levels are normal and the baby's neurodevelopmental factors are also coming at the right time. In addition to that, to get pregnant itself, Carla sir will agree with me that, sir, we want the TSH to be between 2 to 3. In fact, all the studies have shown that you need a TSH of below 2.5 in order to achieve optimal fertility. If you have hypo and hyperthyroidism, one, you have difficulty in conception and increased risk of abortions in the first trimester. So if we look at it, the sorry, I lost the term, the concept of transgenerational transfer of merit, you would say, goes from all the way to preconception to pregnancy and after conception. So whether you call it karma, whether you follow the Buddhist lifestyle, or whether you're following Islam, they all mean the same thing, that we need to bring this all throughout. Each and every action actually has a consequence, and that is why they believe it is very philosophical but very practical at the same time.
Thank you so much. And sir, lots of questions coming up. We got so engrossed in our gossip with each other, we forgot to take questions. A request from many people, including Madam Rekha and Mr. Sadaf Nizam. So, Sadaf, this Isale Sawab, now let's look at it from a transgenerational perspective and for the future generation. And we
Yeah,
can actually share merit through our nutrition, through our medication with the new generation.
absolutely.
So both Sadaf Saab and Rekha Madam ask, could you please repeat the dose of vitamin D, what you just said, the weekly followed by the maintenance dose?
Absolutely. So again, vitamin D3, each lab is going to have different results. There is something called sufficient, deficient, and insufficiency. So if deficient will be less than 10, 10 to 30 is generally, these are the standard values within most of the labs that are being used. 10 to 30 would be insufficiency, and above 30 is sufficient. If it's above 30, give a monthly maintenance dose. There's no harm in it. In fact, the reason they're probably sufficient is because they're already on vitamin D3. Very unlikely that you would be sufficient prior with enough sun exposure in today's day. If they are insufficient, that is 10 to 30, I give them vitamin D3, that's 60,000 international units weekly for 1 month, and then a maintenance dose of 60,000 international units monthly. And if they are deficient, that is less than 10, I like to give them vitamin D3 once a week, that's 60,000 international units weekly for 2 months, that's 8 weeks. In some patients, I may even push it up to 12 weeks, and then continue a monthly maintenance dose of 60,000 international units once a month for however long they need.
Thanks a lot. And to Ramesh Verma Saab, the dose will be the same in men and women above the age of 65. So we'll have the same
Yes.
dose. One question I'll take, this is from Madam Rekha. She asks about the time of administration. So if you are giving a daily dose, 1000 or 2000 units a day, maybe morning would be better because that syncs with the circadian rhythm. And there is one hypothesis, not a theory, one hypothesis which says that if you give vitamin D at night, that may interfere with the melatonin secretion. So, so that hypothesis is there. But if you're giving a 60,000 units soft gel, you can take it any time of the day. Sir, one more question is, can high blood levels of vitamin D in the mother's fetus, can they cause toxicity to the fetus? Has this ever been reported?
Honestly, sir, I've never really come across it till date. It's difficult to mention. Theoretically speaking, yes, there have been cases of hypervitaminosis with D. But honestly, if you continue the maintenance dose of 60,000 units per month after they've reached sufficient levels, very rarely that you'll see a vitamin D3 toxicity. I think, Carla sir, you'll be able to give more insight on this rather than me, because I think you deal with these patients a lot more.
Reshma ji's concern is valid, and thank you for raising this question. Vitamin D toxicity is extremely rare. If at all you find it with injectable vitamin D. There, the dose is 6 lakh units once in 3 months. Sometimes, for whatever reason, usually the reason is bone health. People end up getting vitamin D 6 lakh units intramuscular injection every week for 3 or 4 weeks. These are the people who are at risk of vitamin D toxicity. Toxicity has not been reported with oral medication and has not been reported in pregnancy, to the best of my knowledge, also. We also spoke of the placenta and the endothelial function. Now, the placenta is very good as a filter. The placenta produces its own hormones. It is a target of hormones, and it is also a filter. It knows how to filter all these nutrients. So it makes sure that only the good stuff goes to the baby and the bad stuff
Absolutely.
doesn't go there.
Yeah, the
So
placental barrier, as you said, the placental barrier acts like a homeostatic regulator. So it works very well in preventing the baby from getting into any issues.
Dr. Siddharth Dangar, who is a very dynamic diabetologist from Mathura in Uttar
Yes.
Pradesh, he's joined us and we welcome him. We also
Yeah.
welcome Wo Sahab, who asked about heart failure. So actually, vitamin D helps in heart failure. So anybody with symptomatic heart failure, low ejection fraction, vitamin D should be supplemented. Like we said, the first step is lifestyle modification, lifestyle optimization, and nutrient optimization. You make sure that the proteins and vitamin D are okay. Even otherwise, the heart failure will improve. Sir, we've spoken about pregnancy, we've spoken about the fetus, and we've gone to the next generation. But then there is a question from the audience, including Vinayak Sharma ji. Sir, could you tell us what is the difference between obstetrics and gynecology? And then after that, could you speak about vitamin D in gynecology practice?
Yes. So if I look at obstetrics, is basically where we're dealing with pregnancy. Obstetrics is pregnancy, to put it in simple terms. Gynecology is associated with everything about women's health other than pregnancy, if of the reproductive system. All right. So when we look at like when I look at gynecology, it covers fibroids, it covers endometriosis, infertility. In fact, falls under gynecology, not under obstetrics. It also looks at menopausal health, perimenopause, all your cancers, all your urogynac problems. So when I look at this, in fact, there was this something very peculiar that I came across when I was delivering a talk on vitamin D3 and endometriosis. When I was delivering a talk, actually the talk was on endometriosis, and I came across an article of 2012 where it said that vitamin D3 has zero effect on endometriosis, and it doesn't make a difference whether the vitamin D levels are normal, abnormal, or not. 2018, same author has published that vitamin D3 causes endometriosis and can be one of the precursor factors for endometriosis. So you see, the concepts and the entire thought process is always changing. When the field of medicine, everything is evolving every day. So when you go to look at it, my entire concept is very simple. Even if it is not causing that particular disease in gynecology, or that particular disease in obstetrics or general medicine, or your overall health, why keep anything insufficient or deficient? We should try and maintain normal levels. That's what we, when you look at your kidneys, we want to ensure that your kidney function tests are normal. You look at your liver, you look at your cholesterol, which is the hot topic of today. We always want to maintain all of these things normal. So why not your vitamin D3 levels? Bone health is equally important. Joint health, we always complain that our joints are hurting at a later age and everything, but if we do our diet, exercise, and ensure our micronutrients are proper at an early age, these problems won't arise. See, I see a lot of these issues when it comes to perimenopause, that just before menopause and in menopausal health, that women are complaining. One is your estrogen deficiency, which does obviously cause all of these problems. But if your vitamin D3 and calcium levels would stay normal, it would help in reducing these problems and would not cause as big an effect of the estrogen deficiency.
Thanks a lot. I'd like to apologize to Mrs. Sadaf. I mixed up between Mrs. and Mr. and I apologize. This is gender bias actually, and I'm sure Dr. Rohan also makes the mistake sometimes. We try very hard. Maafi madam, galti se mistake ho gayi. And that reminds me of this wonderful movie जिसमें गाना था गानी गलती से mistake. So question for
Yes.
everyone: which movie was this where the song was galti se mistake? And if you read that, you might tell us the hero also who sang that song, or the singer who sang the song. A couple of questions. Thank you, Madam Sadaf, for your very kind words. When we are able to share information, share wisdom, share knowledge, the Urdu word would be ilm, that is education or knowledge.
Yes.
That actually helps all of us. And there is this Haryanvi proverb, 1 plus 1. Dr. Rohan, in Haryana, we are a bit poor at arithmetic. So 1 plus 1 is equal to 11. So that's what happens through vitamin D talks to and KK talks. Uh,
Absolutely.
Vovo Sahab asks about the vitamin D and sunshine link. So what happens, Mr. Vovo, is that sunshine has got lots of rays, including ultraviolet B rays. These reach our skin. In the skin, there is a chemical known as provitamin D. Ultraviolet rays touch the provitamin D and convert it into pre-vitamin D. Then that pre-vitamin D breaks down into vitamin D. So that's the starting. Unfortunately, sometimes we have very dark skin, or sometimes the sunlight doesn't reach us. So then the provitamin D cannot be broken down into pre-vitamin D. So we're always short. Like Dr. Rowan said in the beginning, you need around 4 to 5 hours of exposure, naked torso, 11 a.m. to 3 p.m. So that's a bit difficult for anyone in the modern world. And another quiz question is there was this story about a king who was unhappy. So he was unhappy and he was a little bit grouchy and grumpy. So he called all the advisors, all the hakims, all the wise men. So they said, "Sir, if you wear the shirt of a happy man, you will be happy." So then he sent his soldiers, all the king's men and all the king's soldiers, they went out into the land searching for the shirt of a happy man. The question is what happened at the end of the story. So let's see if we get answers for that. Vovo Sahab also asked about vitamin D with milk. So earlier, vitamin D is fat soluble. So earlier it was given with milk because milk has got fat. But now the technology is so good, the newer soft gels that we have, you can take them with milk or with water, without meal or with meal, and the absorption will be equally good.
Yes.
Dr. Rohan, Reshma ji asks, some patients complain of leg pain, especially at night. Uh, Multiple questions. Number one, can this be because of vitamin D deficiency? And number two, women in pregnancy comparing of leg pain, no signs. Can we give vitamin D in the same dose that you have mentioned? And number three, should we teach all husbands to massage their wives' legs during pregnancy?
I'll begin with question number three first.
And
Uh,
Rohan, after that, you wait for the fourth question. That is a secret, and that comes from a close friend who is Dr. Altaf Chima from Lahore. A salam from
okay.
Lahore to you as well.
So I'm going to begin with question number three. Yes, all husbands should be trained to massage their wife's legs during pregnancy. I've done it during my wife's pregnancy. So I always tell the patients who come with their husbands, I said, listen, he has to give you a massage. If I have had to go through it, you also have to go through it. Now coming to the most serious question, that's question number one. Yes, women in pregnancy do develop leg cramps. The cramping is not really due to the vitamin D deficiency, but it can be due to magnesium deficiency at times. So sometimes you get now multiple drugs. In fact, all the iron, calcium tablets, and the protein powders generally do contain magnesium. Some of them at least do. So if they are given magnesium with that, please don't ask me the dose. Even I don't recollect it very well because it doesn't come across that often. But magnesium through oral tablets if given does improve these leg cramps and prevents it from happening. If they're having joint pain and this, my advice is just get one vitamin D3 level done, because that's going to tell you whether they need a weekly dose or they need just a maintenance dose, and whether that's actually the causative factor for the joint pain and the leg pain. Number three, I already answered, massage is a must. And I'm waiting for the surprise question number four from sir to come.
That you had already answered. The question was how many years of experience do you have?
enough. I have almost about 12 years now of experience in terms of practice. As a father, 6 years of experience.
Yeah, the question was related to the experience in terms of massaging the legs.
Oh, massaging the legs, I think, sir, 16 years. 16 years it's been going on. I've been married for quite some time now.
So that is a great thing to hear. So see, we have someone who is not only evidence based and who is an expert in his field, but someone who is also experienced. A warm
I
greeting
think
from
that
Dr. Yeah,
I think, sir, evidence and experience matters when it comes down to our
yeah,
practices.
right. And a warm greeting from Dr. Narendra Singh to you as well.
Oh, thank you so much.
Now, the problem is that we've had so many quiz questions, I have forgotten the questions myself. But let's try to answer them one by one. Circa septon means once a week. That's the vitamin D dosage initially for the first 8 to 12 weeks.
Yeah.
Circa tidal, that is from tide, the tides, that is roughly once in 14 days, 12 to 14 days. Circa tidal is the dose of vitamin D when you want to de escalate. Maybe you've not done the investigations, you want to give the medicine, the medicine is very economical, the tests are expensive. So, circa tidal is the way to go after the first 3 months. And circa lunar, that is with the lunar cycle, that's once a month, that is the maintenance vitamin D dose for everyone. You
Yes.
can always choose to escalate or to up titrate. You're on a circa lunar dose, that's once monthly. The patient begins complaining of maybe leg cramps or muscle aches, difficulty in climbing stairs, difficulty in picking up things and putting them in the top shelf, proximal muscle weakness. You can always go up to circa lunar or circa septum. So that was the first quiz question. The other one was Galti Se Mistake, which I think is from Jagga Jasoos. And Hrithik
Ah,
Roshan, if I'm right, was the singer, was the actor. And
Jagga
also,
Jasoos, I think, was Ranbir Kapoor, sir, if I'm
it
not
was.
mistaken.
So let's ask the audience, and maybe someone will
I,
correct us.
I
We'll
think
go with
I
what happened.
think we're both a little. I couldn't remember the movie though.
Okay. And we also get an input from Ali Nazakat Saab, who says that Se Mistake is a famous dialogue of the serial Tarak Mehta Ka Ulta Chashma.
Oh yes, that's also true.
Yeah. Thanks, Ali. So see, हर एक friend जरूरी होता है. So you need friends in the Vitamin D talk show. We've
Absolutely.
spoken today, I think, Rohan, about everything under the sun. So it was Ranbir
I'm
Kapoor. Maybe Rohan is right.
yes. I'm glad. My Bollywood knowledge is not that bad.
This is thanking another friend, Dr. Shashi Khare. Thank you,
Oh,
Dr.
thank you
Shashi.
so much, sir, for solving this debate.
Dietary sources of magnesium, Reshmaji, dry fruits. Now the problem with the all the micronutrients, whether it is vitamin D or magnesium or calcium, the dietary sources are there, but it would be very difficult for any adult to maybe eat 500 grams or 1 kg of dry fruits, or apart from Haryana, for anybody to drink 1 kg of milk a day. So it becomes a bit difficult. There are functional foods, but we need pharmacological support, and this is especially true for pregnancy. So, Dr. Rohan, most of us, we know about the challenges in first trimester regarding nutrition. What about third trimester, end of third trimester? At that time, also, do women face challenges in ensuring adequate hydration and nutrition?
So honestly, sir, when it comes to the third trimester, women do actually have a little bit of problem with hydration because the major issue is that the baby is now beginning to grow, coming down, and it keeps putting pressure on the bladder. What they
Hmm.
don't realize is whether you drink 100 ml or 2 liters, you're going to have to go to the washroom equally as much because the baby is going to keep kicking on the bladder. So it's not
Hmm.
the water intake you're taking, it's just the baby that's growing and playing a little bit of football inside. So unfortunately, there's no option. I always tell, I actually put a blanket statement on their OPD paper that you have to drink 3 liters of water per day measured. You can't be like I'm drinking adequate water. Because when we say that drink 3 liters of water per day, they'll consume about 1.5 to 2 liters maybe. With nutrition, I'm not seeing as much of as a problem. But then at the third trimester, it's like you are like waiting for the baby to come out. You tend to just give way to cravings, and what we see is in the third trimesters, rather than well, it's technically malnourishment because they're overnourishing themselves. We always believe that malnourishment is undernourishment, but malnourishment can also mean overnourishment. So that's also something that I always say, that don't overeat, because your last trimester is when you're going to put on the maximum amount of weight. Gone are those days where we actually say that you had to put on 20-25 kgs to get while you're pregnant. Ideally, we are looking at somewhere between 8 to 15 kgs for a pregnancy, as long as the baby weight is going well. In fact, I had one celebrity patient who put on a total of 5 kgs during her entire pregnancy and delivered a 4 kg baby. She was 6'3". So that is why, even though she didn't put on any weight, the baby had adequate weight, adequate nourishment, and the baby was healthy and fine. It's all about how your baby is getting its nourishment, and not about you putting on excess weight during pregnancy.
And though this is not our topic, let's take the opportunity to remind everyone that drinking ghee at full term does not lubricate the genital tract and
Yes,
certainly does not help in normal pregnancy.
normal,
And then in
absolutely.
delivery, actually, it is the opposite. You will end up with a spike of blood pressure, and then there will be an emergency cesarean to be done.
Exactly. Thank you for bringing that up, sir.
So, sir, it's been great being with you, Rohan. Like we said, we spoke about everything: English, Urdu, religion, philosophy, and even Bollywood. So, could you summarize all this? Take home message: vitamin D in preconception, vitamin D in pregnancy, vitamin D in gynecology, that's women's health.
Absolutely. So, just to end on this wonderful, it's been amazing. Honestly, sir, I didn't even realize that we've been speaking for an hour right now. It didn't even strike me as much. But just to conclude the entire thing, remember, preconception, we want vitamin D3 levels to be normal, because when I look at the sperm health as well as the oocyte health, vitamin D does seem to play a role in managing it. So, we want to ensure that vitamin D3 levels are normal during pregnancy. Vitamin D3 levels, yes, there is research which says that normal vitamin D3 levels are going to ensure a healthy pregnancy in terms of preventing blood pressure as well as preterm labor. In addition to that, if the mother's vitamin D3 levels are normal, the baby's vitamin D3 levels will be normal at the time of delivery, and that's important for the development of the baby. And when I look at gynecological point of view, there are multiple diseases in which vitamin D3 has been linked to contribute as a factor. So it's better to keep the vitamin D3 levels. And just to conclude your overall health, why stay deficient or insufficient in any micronutrient in the body? So if your vitamin D3 is level, and say you're not developed any symptoms, don't wait to fall sick. Just make sure that you're taking it once a week or once a month, and ensuring that your overall health is normal and good, because always remember, we want to prevent and not cure. Thank you so much.
Thank you, sir. So, vitamin D may be a micronutrient, but it has mega benefits on health. And today we've spoken on women's health, maternal health. It's been great being with Dr. Owen, and equally great being with this wonderful audience from KK
Absolutely.
Med Talks. Thank you, everyone, and thank you, Harik friend Zaruri Hota Hai. Thanks for correcting us as well. Thanks for joining us to make that 1 plus 1 is equal to 11. So, Dr. Rohan, now coming back to the real initial part, young
Yeah.
talent, promotion.
Promotion committee. Yes, sir.
So now, do I still have a chance?
So now I think you've qualified to take over my position. The jovialness and the chatting, the way you're speaking, the way your charisma is fantastic. In fact, I can see you as someone who's always promoting the youth. I'm sure, sir, your students must be so happy to have a professor like you who is so approachable. Honestly, sir, you are definitely a lot more experienced than me, but at the same time, you made me feel so comfortable. So at any point, I may call you to take a little bit of advice and understand how you approach life in such a fantastic manner.
Thank you so much for those kind words. I think it's a little bit of balance. I will share this information with my wife and children because I sometimes need help at home.
That's always there.
It's been great. And to everyone, we look forward to meeting you again on the Vitamin D Talk Show. To Dr. Rohan, it's been a great pleasure being with you. Thank you
Thank
so
you
much.
so much, sir, for having me here as well. Thank you.
Jai Hind, Dr. Rohan.
Jai Hind.